In other business news, Life Healthcare has reported solid numbers for the 6 months ended in March, driven by robust activity growth and benefits from acquisitions. The private healthcare group posted an 8% revenue increase to 12 billion rand thanks to strong activity growth and increased demand for services. Earnings before interest and tax also rose to 1.86 billion rand. The entity further communicated expansion plans, which include the commencement of a new hospital building in the Western Cape. The group has further announced the sale of its LMI business for 13.9 billion rand, and the proceeds are said to be returned to shareholders. Life Healthcare CEO Peter Wharton-Hood speaks to us about this performance. Thank you so much for your time, Peter. A decent performance under the current economic landscape. Do talk us through the highlights.
It was a tough 6 months, and we're pleased to report the results that you have just spoken about. It was largely the result of a 3-year plan to actually start to drive more activity through our hospital complexes, a direct result of incremental arrangements with our funders and networks, active doctor recruitment, and in selected areas, the expansion of hospitals where the capacity was not meeting demands, and that additional capacity that we added filled up very, very quickly. So it's great to see activity nearing the pre-COVID levels, and hats off to the management team and the staff that drove the growth.
Quite encouraging, and it brings me to ask about the near-term outlook given the state of the South African healthcare sector, especially after the latest version of the 2025 budget speech.
Well, our responsibility as a hospital provider is to see through this uncertainty. Higher or lower levels of uncertainty doesn't change anything to the disease burden in society, and we've got to keep a cool head. The responsibility is ever increasing, and our navigation through these complexities is around making sure that we provide a stable and consistent level of care to the patients needing our services, and by the same token, actively participating and engaging to settle this uncertainty that is prevailing around the healthcare sector, because uncertainty benefits no one, least of all investors who don't like levels of uncertainty, and their money doesn't follow places where things are uncertain.
Lastly, to what extent is the business preparing for the unknown eventuality of the NHI in the healthcare sector in South Africa? Another uncertainty?
Well, we've extended the hand of partnership and collaboration to government. Our forthright stance on the topic is that improving accessibility and affordability of care will require the cooperation between the public and the private sectors. So in that sense, we've introduced constructive dialogue on the topic. Insofar as the management of our infrastructure, the employment and training of nurses, the expansion of our facilities, that carries on regardless, because demand for good quality, accessible, low-cost health or cost-effective healthcare exceeds the available supply, and it's our responsibility to keep a calm head and keep doing what we're doing.
Thank you so much for your time and your input this afternoon. Peter Wharton-Hood is the CEO at Life Healthcare.